so much for the introduction. I will talk about a topic that maybe is not so common, but it's important to notice and the way we can handle that. I don't have any conflict of interest. What is siderosis? Siderosis is a disease characterized by the accumulation of iron in various tissues, have a typical color of brownish gray decoloration of the skin, and can be seen as a side effect of the injection area after parenteral iron treatment, but even that, you can obtain that with any kind of trauma. The needle or cannula on the buttock area is a trauma. The causes, intravenous iron administration is more common. Muscular injection iron administration, I want to show you that is more common than maybe you suppose, and post-trauma or post-surgical hematoma. I'm making research using these two words, skin siderosis, and I found only this kind of 36 papers between the last 40 years, but if I put focus only in gluteal siderosis, I find only 2 papers talking about that. That's why we need to put focus on this, because it's a permanent pigment in the area. The first report is only report, don't have any solution, only comment about this siderosis in the area and the permanent pigment that caused to the patient. After that, an article which one was a research. In all articles mentioned that siderosis on PubMed and Cochrane database. They summarize all the patients in the 7 articles. It's a total of 54 patients, all females. 84% of them was made by iron injection, and they declared that in 54% have successful clearance. One of these papers, for example, is this one. And you can see here the pigment on the forearm, on the arm, because using iron by using IV administration usually is in any kind of anemia situation where our doctors ask us indicate iron for this disease. I take the only one paper who mentioned the gluteal situation and the way we can handle and give solutions. He treated only 5 patients, 4 in the gluteal area, 1 in forearm. The patient from the gluteal area was for iron injection, in the forearm for iron EV. They used 2 kind of quick laser, all nanosecond, a ruby and new light laser. In total, the weight was between 3 to 16 sessions, and all patients in this lecture, in this article, mentioned that was market clearance. As I mentioned, it is the first fact. The only way to have successful treatment with this is using quick laser, or nano or pico. But I'm going to give you my opinion in which one you need to use. Nanosecond is not so far, it's not so fast. It still have at least any kind of photothermal effect. That's why not so common, but in many cases, you can obtain a scar. If you use a picosecond laser, it's close to a use only photomechanical effect. That's why you can avoid any kind of complications. Faster the devices, more powerful, you obtain more degradation particles, and that's why you getting more easier the work of our macrophages to eat this particle of ink and throw it away. And here is a drawing to explain the way it works. Here is all of us play with the Pac-Man when I was younger. Maybe you still play with the Pac-Man. The problem is the phantom is too big. And our macrophages have a size of the mouth and can eat it. That's why I applied the picosecond laser. I made this great phantom, a little phantom from pebbles to sand to dust, and our macrophages getting well eaten and thrown away by the lymphatic system. Through the nodule and finally to the kidney, and through the urine we can throw in from our body. This is my experience from July 2015 to July 2024, 9 years, for a total of 22 patients, all females, between 70 to 51 years old, with the average of 34. Bilateral situation in 16 of them, unilateral only in 6. The rate of my session was between 2 to 15, with the average of 6. Looking for any kind of way to measure my result, I look for this satisfaction level survey made by Rowling and collaborators, and the rating between 4 to 1, and I add another one, 0, no clearance at all. Complete clearance 4, marker clearance 3, moderate clearance 2, nearly to clearance 1, and I add 0, no clearance at all. And this is what I found when I asked my patient to complete the survey. I obtained 16 answers of all the 22. It means 72% of all my patients treated complete the survey. 6 patients, it was impossible to find it or contact them or to obtain the answer from them. That means that 75% of my patients rated as moderate to complete raise of the siderosis by this treatment, by the use of Guteal laser. 18% of them answered that no clean at all, but these 3 patients to rating 0, they don't complete the treatment, only 4 sessions. This is all the data of my patients. I start write a paper, and by this I have this info. And this is the mechanism of action, and I have some first facts and some doubts. First facts, iron injection usually are performed intramuscularly with a long needle, no less than 40 millimeters. That means it goes inside the muscle. The other fact is usually Guteal laser only can reach all the deep of the skin, no more than that. That means 6 to 7 millimeters of deep. Well, in which way can be successful? This is that Rowling found in histological result. They found macrophages with all pigment inside the dermis. And this is my hypothesis of work. It appears that macrophages transport the iron deposit from the inner muscle through the lymphatic system, reach the dermis, and by this Guteal laser can be successful, as you can see in a few seconds. I have only one patient for post-trauma. It's a patient that applied many shots, many injections of hyaluronic acid, and he rejected of the treatment and asked to the colleague to apply hyaluronidase to eat all this hyaluronic acid. That means a lot of injections, a lot of trauma, and this is the result. Even that, the patient discontinued the treatment, but even that, she rated that at least we obtain a slight clearance of the pigmented area in the buttock. This is the treatment. This is in real time. This is for the one to have the Guteal laser and in pico. This is my parameters. You can copy that. I start always with the large spots, 10 millimeters, and session by session I reduce the spot size and I increase the power between 1 joules to up to 2.8, no more than that. And I look this endpoint as successful endpoint: erythema, mild frosting, and mild swelling. If I don't reach to this, I still looking for that and apply many passes to obtain this endpoint to be sure I was successful. Well, take a look to my result. This is before the treatment, after 5 months, even during the treatment. After 1 year, we stop only 9 sessions, and I have the possibility to call the patient and return for a control after 4 years, and you can see here a complete clearance. The same patient in the other side, same situation. Before, after 5 months during the treatment, after 1 year, we stopped the treatment, and the patient returned, and you can see here a complete clearance. And he has answered the satisfaction level survey as 4, of course. Another patient, we don't have answer from this patient, but for sure, if I am honest, the patient needs to rate at least 3 or 4 because it's nothing of the original color on the buttock. This is the other side of the same patient with the same situation. No answer of the survey because it was impossible to find her, but the result was successful. Another case, again, in only 5 sessions, we complete the treatment. Another case, market clearance level, he answered as level 3, but as you can see here, is a great change in the amount of color. And another one, they don't answer the question, but again, if I be honest, at least a slight clearance of the situation, of the initial situations. All this info give me the possibility to write an article in a book of a friend of mine, Gabriel Huertas is one here, if I know. And now, my final message for you. Gluteal siderosis is more frequently injury than previously thought. Any application of intramuscular iron carries the potential risk of gluteal siderosis, and even any kind of trauma on the gluteal area, with a cannula, with a needle, or anything of that can have hematoma. This hematoma is hemoglobin outside the vessel. It's transformed in hemosiderin. It's a permanent pigment. Taking into account this diagnosis, when you treat this area, the only successful treatment is by Q-switch laser. If you have the possibility, look for a nano, for a pico, not for a nano. And in general, more sessions, more clearance, and more satisfaction rate of your patients. I invite all of you as part of IMCAS Board of America to the next Congress in Sao Paulo. Thanks so much for your attention.